Okay, I think we're going to go ahead and get started. We'll wait for technology to catch up. I notice a lot of comments about the audio, so we'll do the best we can. I'm sorry, we're trying to work out the technology here. So I will hold the mic closer and speak clearly and ask that other people do the same. So I am going to hand it over now to folks from the Seattle Indian Health Board. I'll let them introduce themselves first and share an overview for us. So thank you.
Good evening, everyone. I'm hoping the sound works. And I'm going to try to project my voice, but I do have a soft voice, so give me a sign kindly if if you can't hear me. My name is Shelley Means, and I am Ojibwe and I am Lakota. And my parents met in Seattle, where I was born, and I've lived on Vashon Island for 28 years. I'm proud to say that for about 7 years, I have served on the board of directors for the Seattle Indian Health Board. The presentation tonight is not going to be about me. I really want to start our time presenting from our new neighbors, the health board, by opening in what we say is a good way. I don't know if any of you are familiar with here in the Coast Salish territories, there's a tradition of witnessing when there are big events and there are times when we come together in community. The way that we open is acknowledging that we are witnessing something together here today. And so each and every one of you and I, we are witnesses to this presentation where you all get to meet the Seattle Indian Health Board. So I'm going to start us with a blessing. Creator, we are grateful for the abundance of this place that we call home and all of its living things, all of the water, all of the ancestors and the peoples who were acknowledged earlier in this meeting. Creator, we're grateful for the air that we're breathing. Please bless the people who are not in the room with us. Bless the people who are grieving, people who are experiencing addiction and other diseases. Bless our babies and bless our elders, our precious elders. Creator, we ask you for health. Thank you, all my relations. Aho.
So yate everybody, I actually do have a loud voice, so I'm hoping people can hear me both online and also in the room. My name is Esther Lucero, and I'm Danae on my mom's side, and I'm really proud to say that my mom has chosen to be here today as a witness. She's visiting from Phoenix, Arizona, and came across in her first ferry. Yep. Oh, that's harder for me. I'll do my best. That part is harder for me. I am a policy wonk. That's basically my educational background, which makes me talk super fast. So I apologize for that. But I'm Danae on my mom's side, and I'm Latina on my dad's side, and I'm third generation in my family to live in an urban area. And so it is very important to me that we begin in a good way. I'm grateful to Shelley, not only for her leadership on the board of directors, but also for her role in community as an auntie, always making sure that we move in a good way. So do we have the presentation? Okay, if not, I can kind of, yeah. Oh, my goodness. Oh, wow. Oh, this is amazing. Thank you so much.
And this is from Diane, who's not here this evening. She is a landscaper and is very excited about the
oh, that's amazing. Thank you. Theater for us is a protection medicine, so it means a lot. Thank you so much. While we're getting this going, maybe I'll have my team introduce themselves. They will be joining for our question and answer session. Am I doing better? No, still no. Okay, but I'll try. These guys slow me down. How about that?
Osio Nagada, Social Love, Dawadoa, Jijalake Uchi, Ale Delaware. Good evening, everybody. My name is Dr. Social Love Thurman. and I'm a citizen of the Cherokee Nation on my mother and my father's side. And I'm Delaware on my father's side and Yuchi on my mother's side, originally from Oklahoma. And I have the pleasure of serving as the Chief Health Officer at the Seattle Indian Health Board. I am a family medicine physician and have been at the health board for 10 years. I did my training as a family medicine physician at the health board because part of our mission is around workforce development. And that's something that I'm really passionate about, is making sure that we're always creating opportunities for people to learn and grow together. And I got to train as a doctor in our clinic and have been really happy to continue to do family medicine or primary care at our clinic, as well as continue to really invest in our learning and development for other family medicine physicians. So I have the pleasure of being able to oversee all of our health and human services. So our primary care services, as well as our behavioral health, dental services, which we're also really excited to talk to you all about at some point, as well as our pharmacy and laboratory that we provide. So thank you very much for having us, and I'll introduce Ryan.
Good evening, everyone. My name is Ryan Gilbert. I serve as the Chief Operating Officer. I've been here for about 4 years. I was born just around the coast here in Port Angeles, went to high school in Olympia, and joined the Marine Corps in 1995. I haven't lived back in Washington again until about 2018. After I got out of the Marine Corps, I became an entrepreneur and moved overseas. I lived in Japan and started an international business over there and sold that in 2008 and moved to Alaska. And if everybody remembers, 2008 was not a really great time to be back in the US. So I ended up working in the nonprofit sector, and that's where I really started my career in healthcare. And I've really been in this track ever since. My first job in healthcare was the CEO of a company called Sean Lute, which was a residential treatment center in Alaska that was run by the Athabascan organization, Cook Inlet Tribal Council. And so I'm happy to be here tonight. Look forward to any questions that you might have later on. Thank you.
So I want you to share with the entire island 2 things: that our operations are run by a Marine, and that our health and human services are run by a woman named Dr. Love. Dr. Love. Okay, let's talk about the Seattle Indian Health Board for a moment. Next slide, please. Okay, Seattle Indian Health Board, I have a video here for you, but in a nutshell, I just want you to understand that we're probably best known for health and human services, and we do so much more. Frankly, we operate the Urban Indian Health Institute, which is one of 12 tribal epidemiology centers in the nation, and the only one that actually has a national scope. Has anybody learned and are concerned about the issues related to missing and murdered Indigenous women? Yes. Do you know that that report came out of our organization? The report that prompted legislative change across the country came out of our organization. So we have a community health arm and we have a public health arm. And the most important part of who we are is everything we do is centered on traditional Indian medicine. So I have a little short video here. Yes, let's launch it. Okay. Okay, perfect. We're going to try to connect the video, and if not, it will be in the chat for you, for folks who are online.
It was a time of assimilation. The Relocation Act really encouraged Native people to move out of reservations and into urban areas.
They gave everybody a one-way bus ticket.
So I
Seattle
want to know
Indian
who
Health
this
Board?
woman is, and do you need a job? Yes.
Rose from the social justice movements of the late.
Okay, let's just skip that. I'm just going to talk to you about it. How about this? Yeah. And if you have it in the chat for folks who are here, you can take a look at it yourselves later. It's really amazing. It's about 2 minutes. So let me just tell you that Seattle Indian Health Board has been in existence for 52 years. That means it's older than I am, which tells you, oh, I'm sorry. Shelly's telling me to slow down. My goodness. Okay, let's see. Take a deep breath. 52 years. And like I said, we are best known for health and human services. So we serve all people the Native way. We are deemed a federally qualified health center, and we're an urban Indian health organization. Our urban Indian health organization is a special statute, a special status that occurred through the Indian Healthcare Improvement Act, and it's permanently reauthorized through the Affordable Care Act. What that means is our Indian Health Service status is our tier of authority, right? So you all are familiar with CMAR, which is a federally qualified health center. But I want you to know that our federally qualified health center status comes second. It is also the reason that it gives us financial stability. So I want you to know that during the pandemic, for example, we were the only community health center that didn't lay off anybody. We were the only community health center that didn't close our doors, right? We're the only community health center that didn't shut down any services. Yes. So I want to tell you that because I know that there have been concerns about our financial viability, right? Whether or not we're going to stick around. So we've already been here for 52 years, and I'm telling you, we have at least 100 more coming. So I've been in the organization for a little over 7 years. And let's talk about finances for a moment. My presentation wasn't going to go this direction, but let's do that. When I arrived, our total revenue was $10 million. That was in 2015. Anybody take a guess where we are today? What? This is an auction. Am I hearing more? More. How much? Take 10 million more. 20 million. Am I hearing 30 million? 30 million, 100 million. How about 50 million? Okay, 50 million. We're really proud of that. The reason is because we understand what it takes to leverage this Western healthcare system to make sure that we implement sustainable programming. Now, I'm president and CEO. That means that I think about money a lot. But what I understand is that when we have enough resources to do services in our way, not only do we have better health outcomes, but we have the ability to provide services for more people, right? And that's what we're here to do. So we also operated a 65-bed residential treatment program in Rainier Beach. And I want to tell you a little story about how we came to Vashon. And it is hot in here, so I'm taking this jacket off. Thanks, Rain. So right before the pandemic hit, we had a visit from a friend of ours. His name is Kenny Smoker, and he is out at Fort Peck Reservation in Montana. And he came to us because he knew we had a residential treatment program. And he told us, he said, you know, Esther, you guys have to do something about this. We're losing generations of our babies. And we're losing generations of our babies because if a woman is pregnant and she is struggling with addiction, her children are put into a foster care system. And our tribes are underrepresented in that foster care system. And we're losing our kids. Please, can you help us? Our residential treatment program didn't have the ability to serve pregnant and parenting people. It was an old building. It was grandfathered in, so it wasn't even ADA compliant. And we knew we had to make a change. It was at that moment that we decided to pause services and began looking for another site. So we sold that site. And all I could think about, and I pray on everything we do, and I just kept thinking, we need a beautiful place where these moms and babies and families can heal. That's what we need. And so we worked with the King County Assessor's Office. We looked at all of these properties that were potentially available. We looked at North Bend, we looked at Snoqualmie, we looked all over. And we landed here. Yeah. So what I know is when we stepped on the property that was formerly VCC, I knew healing could happen there. Because finally we found a place that was deserving. Our people deserved this place, healing place, that they could move away from anything that caused them trauma and propelled addiction. We knew that we could pull them away just long enough to help them get healthy. That's how we landed here. So we were able to say to Kenny, yes, we're going to be able to provide 10 beds dedicated to serving pregnant and pregnant people. We're expanding from 65 beds to, oh, I see a presentation now, to 92 beds. 92 beds. Can I see the next slide? Where are we? Oh, okay. And let's just backtrack really quick. When I talked about our Indian Health Service status, this is what it looks like. We call it the ITU system of care, meaning I stands for IHS Direct Hospitals. The T's are Tribal 638. So many tribes have their own healthcare delivery systems, and the U is us. So the tribes look at us as part of that continuum of care. And it gives us another source of funding. And that's really, really key. And also a different relationship with the state government and the federal government. Next slide. This is the Public Health Authority we talked about. Keep going. Uh-oh. It's not showing. That's okay. So our service delivery model, what it would show you is that we call our patients our relatives, right? So when you hear us refer to our relatives, it's because we really think about that in regards to family. And so we wrap around services around our relatives. Keep going. This is our executive leadership team. The reason this is important is because I want you to know that this organization is led by skilled executives. I also want you to know that our executive leadership team, for folks that are really committed to equity, is defined by equity. So here we have myself, we have Abigail Echohawk, who's our executive vice president. She runs all of our public health work. We have Linda Zhang, who's an incredibly skilled CFO. Andrew Guillen is our chief public affairs officer. Pam Grinley is our chief people officer. And then you get to hear from Ryan and Sosha tonight. Next slide. This is what our staff looks like. 203 staff, 80% BIPOC, 50% American Indian Alaska Native, 73% women. I would say 11% LGBTQ. So equity is all the buzz, right? I want you to know that we are living equity. If you want an example, this is what it looks like. Next slide. And this is what our leadership looks like. 75% BIPOC, 50% American Indian Alaska Native, 75% women, 25% LGBTQ and Two-Spirit. Next slide. Folks may or may not know that 76% of all American Indians and Alaska Natives live in urban areas. 76%. You may not know that only get 1% of the Indian Health Service budget. Next slide. Our relatives we serve. So I get this question a lot. Do you serve more than American Indians, Alaska Natives? The answer is yes. We recognize that our cultural ways are just as impactful and valuable for non-natives as they are for Native folks. So right now, our relative population, 67% are American Indians, Alaska Natives. I mean, yes. And 50%, I've already talked about our employees. This is our Indigenous knowledge-informed systems of care. So what this means is every single thing we do is grounded in traditional Indian medicine. When folks ask about Thunderbird Treatment Center or the treatment center and our service delivery model, you're going to experience sweat lodge. You will experience sunrise ceremony, talking circles. And it's really important and valuable because that is the reason we stay sober. When we operated our resident treatment program in the past, we had the lowest recidivism rate in the state. And I will tell you, it's because of this. We have a clinical psychologist. His name is Daniel Dickerson, and he did a study on the drum circle. And in that study, he proved that the drum circle is just as effective as AA for sobriety. Yeah. And why is that? Because we have cultural protocols. You cannot participate in ceremony if you're using. You cannot. And so it's about helping you understand your traditional tribal roles. Sometimes just understand, like sparking that blood memory so you remember who you are as an Indigenous person. And when I look around this room, people are like, but I'm not Indigenous. Well, if you go back far enough, indeed you are. Next slide. In regards to culturally attuned services, this is what it looks like. Dr. Love lives this stream. So we have our relative here. When we talk about wraparound services, we're talking about primary care. We're talking about nurse care manager. We're talking about medical assistants. We're talking about a floor nurse. We're talking about a traditional Indian medicine as part of every care team. Traditional Indian medicine apprentice. We're talking about a dentist. We have clinical pharmacists. And if there are any healthcare providers in the room, you know how valuable those folks are for med management, right? We also operate a 340B pharmacy. We're establishing a new retail side of our pharmacy as well because we have a naturopathic doctor who provides herbal medicine support. Behavioral health specialist. We know that there's an intersection between substance use disorders, mental health challenges, historical trauma, right? The most neglected service is dental. And then we have specialty providers where a network of traditional Indian medicine practitioners will come through. Will rotate through as many different Indian medicine practitioners and from as many diverse people. Because we are not homogenous. This isn't about some weird pan-Indigenous movement. It's about us honoring our diversity, right? Respecting our cultural epistemologies and making sure that we utilize those to be healthy again. Okay, next slide. So when we had our former treatment center, 61% of our patients completed the program. And for folks who are in recovery, you know that's pretty significant. 84% were under the federal poverty level, and 69% identified as American Indian or Alaska Native. Next slide. The new facility, I already said, will take us from 65 beds to 92 beds. We operate on a 45-day intensive treatment model. And for folks who need additional support, we can renew that 45-day treatment model. This is the reason that CMAR is supporting our efforts, is because they recognize that we have a rotating built-in population who will need those wraparound services as well. They also understand as a federally qualified health center that we will have to provide services to all people. Let's see. Right now, for folks who are at the Strawberry Festival, we introduced our mobile van, which currently is outfitted for 2 dental operatories, but we can operate any service out of that van, just like it was a clinic site. So it's medically assisted treatment. People are looking at the opioid epidemic, right? That takes using medically assisted treatment, low barrier buprenorphine. We can do that out of that van. We can provide mental health services. In fact, during the pandemic, we turned that van into a testing site and also vaccination site. That's why we wanted to introduce it to you. It's likely we'll have to use that when we get all of the other services up and going. I think I missed the slide on, oh yeah, next steps, keep going. So these are the things that we've done. It was really important for us to go and engage our tribal partners, which we've done. And these are the folks that we've met with already. We've conducted our feasibility work. So understanding what is possible there and what our limitations are and doing just really good planning. We've done the preliminary design to make sure that we have enough space to meet the capacity that we want to meet. We hired an environmental services director who lives on Vashon. His name is Brian. He's fantastic and has like a really incredible extensive background in services in a residential program. We're closing out the RFP period, Ryan, this week. This week, the RFP for the general contractors will be closed. So we will have met that that timeline. We're looking at securing our property. I think one of the things I was surprised about is since we actually purchased the property, it's been broken into 3 times. So it gives me a little bit of concern. So Ryan will talk to you a little bit about how we're securing the site. I think what's really important to me is that we keep our relatives secure. Is that my time? My 30 minutes? Oh, no. Okay. Is that we keep the relatives that we are providing services for safe. And so we'll be looking at that. In addition to the fact that I do not want our traditional medicine, our ceremonial spaces desecrated. So just keep an eye on that. We're going to do that in a meaningful way and a very thoughtful, beautiful way. We're looking at creative ideas to address the workforce needs, right? We know that we will be providing jobs for folks who live on Vashon, of course. And we also know that, especially when in regards to specialty providers, we will have to probably rotate those folks through. So one of the ideas we're pursuing is looking for land. And I don't know if folks have ever experienced Getaway, which provides like container cabins for like an outdoor experience. We're looking at something like that on property that we could use for workforce housing. It helps us overcome some of those permitting challenges. I'm looking at my techie friend here. She knows what that means. You know, permitting, it also allows us to provide that space for folks if they want to participate in a getaway, and allows us to generate passive income, right? All of these revenue sources help us sustain the work. Does that make sense? So we're looking at that. And then we're also working on transportation. So one of the things that we did before we even purchased the property was work with King County, Joe McDermott. And we're trying to get access to 24-hour water taxi, either through purchasing or through a special contract. We've also talked with some of our tribal partners who actually operate ferries. And we've even talked with Senator Patty Murray. Like you all know that they added a ferry to the Strawberry Festival timing. Did you guys realize that? They added one additional ferry. Well, Patty Murray had come to visit us the day before, and we talked to her about the ferry challenges on this island. And it just so happened that Pete Buttigieg was visiting her the next day, and they were touring, and they toured here, right? And so I want you to know that we have really good connections there. And we won't stop until we find creative ways, because obviously if we're serving pregnant people, we need to have access to emergency services. So I will work on that problem. Also, this is the architect we're working with. So the VCC property is gorgeous, it's beautiful, but it's not indigenous. And so we're working with John Paul Jones, who's a Choctaw architect. This is him, and he actually designed the Smithsonian Museum of the American Indian. And so he's helping us indigenize that space. Yeah, he's amazing. Actually, he's my birthday twin. Both of our birthdays on Sunday, just to let y'all know. So we're pleased to do this work, and he has so much experience here. We even have space to build a longhouse there. Yeah, when we talk to our tribes, they have a lot of interest in having a canoe journey when we finally open. So in regards to the timeline for opening, we're looking at 18 to 24 months. I am always optimistic, so I'm saying 18. Ryan will give me side eye and say probably 24. But yeah, we're working diligently to get this done. Next slide. Okay, this is probably the time you've all been waiting for. I'll have my team join me for a question and answer, because as you all know, great leaders hire incredible people. And I'm really pleased to announce that I'm the least skilled member of our team. So these guys help us run the day-to-day.
Esther, I think I'll just interject. We'll try to take questions both from folks on Zoom and in the audience. We'll sort of ping back and forth. And I know we've all been hearing lots of questions from the community. I know there's lots of questions and perspectives on this. So we'll ask that folks keep your question or comment to a minute at the most. We're going to time so that people don't, go on. We want to give everybody space to ask a question or share their thoughts. If you have questions we don't get to tonight, let us know and we'll continue the conversation and we'll post that or figure out a way to circle back and answer those. We'll do our best to try to get as many in the next half an hour that we have. Jake, yeah, if you want to do that.
Hi, everybody. It's really an honor to be here. And I'm just so excited about what you have to say, what you presented to us. So my name's Patrick, and not that it really matters all that much, but it's kind of an island tradition to talk about how long you've been living here. It can be a bit obnoxious sometimes, but I've been here for 22 years, so I'm just a recent arrival. I'm a professor at the University of Washington. Very interested. I guess the question is the linkages between recovery and the environment. And I think one of the reasons that you were interested in this property was because it was a space that could inspire people to recover. I also want to say that, like many of us in this room, we recognize that there is a problem with addiction on the island. When my daughter, who's now 21, we did our Guiding Goods Choices class on the island, which is parenting around addiction issues on the island. King County came out and said Vashon has the highest rate of alcohol and drug use among youth in King County. And it's an ongoing challenge on the island because there's a lot of just going into and drinking and using drugs. There's a culture of tolerance. And so I just want to say that I think it's really welcome. And I know there's concern about crime, but we also recognize that there's a big problem with people driving under the influence on the island, which is a crime. And there's a big need for treating addiction here on Vashon Island. And so I really welcome your presence. So thank you very much.
Sure. I'm going to answer. I'll have Ryan join me for the second part of the answer. Yes, we do understand that there are addiction challenges here, and which is why I want to make sure that folks understand that we are part of this broader system to address the issue. To be quite frank, residential treatment programs have been closing in this state. If you're functioning off a straight Medicaid system, you are going to fail. And when you have somebody who needs access to a bed, it takes forever to get them in. It's the other reason I need to solve the transportation problem. Because when people go into recovery, it can happen at any time. Be ready. Back to your question about the environment. Yes, part of our indigenous psychology model is reconnecting with the land. In fact, to serve pregnant and parenting people, it is a whole gardening model. And so it is very important, not only to get folks out of the environments that, really fuel their addictions, but also because you just need a place to think, to reconnect with yourself, to heal. And so that is very, very important. And so it's a huge aspect of what we do. I'm going to let Ryan speak to the questions about Ryan. So.
To your comments about the crime already on the island, we are obviously aware of that. As just mentioned, we've been broken into. It's actually, she mentioned 3 times. It's a little bit more than that if you count people that have come in and stolen diesel fuel out of our generator. And so when you count those, it's probably more like 6 times. And the people that did break in, it looked like there was drug paraphernalia left in the building. There was some things that went missing, but it is a part of the reason why we want to secure the property. And so what that will probably look like over the next few months is a cedar fence, and then I think what you'll see from the street is a gate. And in staying consistent with our practices, it will be a gate that's decorated in an indigenous way that's representative of our values.
And when we operated our residential treatment program before, in all of those years, and it was open since 1984, I believe, we had no criminal activity in the neighborhood, and we were literally in a neighborhood. We had houses across the street that came from our folks that we served. 0.
And so one of the questions, I've been in touch with Matthew, the fire chief, interim fire chief, and he called me early on when we were identified as the buyer of the property, stressing concern about 911 calls. He shared with me that at VCC, there was at least 3 to 5 phone calls for 911 a week for when it was assisted living. And we look back on the same records for when we operated our residential treatment over on Rainier, and we didn't have any calls from 911. Well, 0 is an exaggeration, obviously over 30, but there were very few. And so I told Matthew, I'll tell you that the emergency call is something that's regular with our residential treatment.
For those people with questions online, we're having audio issues in the room. Will you type your question into the chat and we'll present it to the Sure, perhaps Katie. Katie, I see you have a question. Do you want to unmute yourself and ask the question?
Yeah, so I came to Vashon to get away from homeless people and drug addicts. So this is a really, really, really uncomfortable thing that you're coming here. I appreciate your telling us about the 10 beds for the moms and babies. But what happens to the 80 plus other beds? So my math is this: if you want 92 beds every 45 days, that's 736 addicts coming to the island. By your website, you say 61% recidivism. There will be 40% of that 736 that are going to walk out of your building. I have personal experience with a drug addict. I know how frightening they are when they are, desperate, erratic, trying to run away from the rehab. I've experienced it firsthand. It's quite terrifying. So there will be, by your math, if you have 92 people every 45 days, around 300 people that are going to walk out of that facility. How are you going to make them leave the island? My other question is this: the people that do finish the program, and a lot of people who are addicts are homeless, where are they going to go after they finish the program? I come from a place where fires are started by homeless people, and that is going to be a big concern as the planet heats up and this place gets drier. I'm worried, very worried, that people are going to start camping out in the forest, that, they're going to stay here. This is a beautiful place. There's also drug dealers on the island. So they're going to, they're the ones celebrating all of this. I'm honestly speaking on behalf of a lot of people who are afraid to. I'm taking a bullet for the team here. And there was a list of questions I gave Deborah from Islanders. You know, my heart goes out to the people on either side of this facility, because I know from rehabs, a lot of people are smokers. You talk about drum circles, you know, you're talking about bringing a lot of people here and a lot of noise, and a lot of those neighbors around that facility have been there for decades, and their way of life is going to be changed dramatically. So I'm extremely concerned about this. And honestly, I probably wouldn't have moved here had I
So
known.
let me first acknowledge that, yes, indeed, if you are an untrained professional and you are having to support an addict, that can be terrifying. Let me just acknowledge that. I also want to acknowledge that these are folks seeking healing. And we know that if the majority of folks are going back into the world in a healthy way, that benefits all of us. Now, this idea that they're all homeless and criminals, that's just false. It's a false narrative that I refuse to propel, because we need to be part of the solution. You know, it's interesting because when I drive through Vashon, as beautiful as it is, I definitely see homelessness. I see substance use. And so I'm coming here as a good community member to help you all with that too. It's interesting because we have a whole team of providers, not just doctors, not just mental health providers, not just social workers, care coordinators. We have aftercare support. We have folks that will help transport them, right? To make sure that they can reintegrate to their own communities, because I'll tell you, that's what they want. They want to go back to their babies, back to their families. They want to go back in a healthy way. They want to be part of this community, of their communities. Sometimes they need a moment to get away. We set them up with jobs. We help them with work skills. We help them reconnect with their families, make amends in those good ways. And yeah, can we all say it? I mean, hey, I've been a case manager. There are many times that I've had moments where I was like, wow, this can. But you know what? I get back up and roll that hill with that rock back up, because we have to. If we don't, we're going to breed generations of addicts. If we don't have any solutions, it is going to become more of a problem. And if you think you're protected from it, you're not. You would much rather have an organization here who is part of the solution and has the training and tools and skills to take care of our people. We were in a neighborhood before. Our neighbors loved us. They were sad when we left. They were sad when we left. And if you give us a chance, you're going to be sad too if we leave.
I'm Margaret Bickle. I live next door to you. I am very close. And I was wondering, you know, you talked about having a longhouse, a drum circle, a sweat shop, or whatever, you know, I'm the building. I said, and you know, the last and parking, and I'm wondering, do you have a diagram where you're going to put this? Do you have a plan? Is it something that you can share with the neighbors so we know what's going to happen next door to us? I mean, we've just heard wonderful things about how everybody's going to be great and it's going to be wonderful, which it may be, but I don't know what's happening next to my house. I think, you know, and are you going to have, like, when people leave, I know other places, they have methadone where they come back and get methadone. Is that going to be part of it? Oh, good. But anyway, I think when the nursing home went in, they came and they showed us diagrams and we knew what was happening next to us. Right now, we have no idea.
We do have diagrams and we are incredible planners. And we've always been transparent in any new development we've had. And when it's time to share with the community, we will share. We want you to be part of this, but we don't share things before we're ready, because we don't like to make statements that maybe will change. People have a hard time when you do that. So as I said, we're working with an architect. We have preliminary designs I don't think they're going to be exactly that. So I don't want to share it with you until I know exactly what it's going to be. And yeah, I mean, ceremony is wonderful. For folks who have ever experienced it, it changes the environment in a good way. Calling in good medicine. Really important. I think, is there another part of your question? Am I missing? Is that good?
David, are you able to unmute? Oh, okay. His question is in the chat. Will the Seattle Indian Health Program include follow-up care? Will there be relapse prevention programs?
Okay.
We actually don't do methadone. That's not something, it's higher risk than we are prepared for. We don't want to do that. We do low barrier buprenorphine. We do intensive outpatient as well. So I will tell you that. So there is no methadone clinic where they're getting a daily dose.
That wasn't really my
No,
question.
they would do that in our outpatient setting. But if they somehow relapse, then they could come back for another time to try again. Sometimes takes multiple times.
Yes,
We
that
have
was yeah.
3 clinic sites in Seattle. And if we do, or if we're able to expand to build a clinic here, we'll operate outpatient as well, which is really great for community, for folks. Yeah. Yeah, but I don't think I completed the other question. So yes, we do have an aftercare program. I want to be very clear about that. It's not that they just go out and they hop on the ferry when they're done. It's not like that. Okay. And then the trail. Sure. So the question about the trail. Yeah, right now, the trail is obviously a really important part of our treatment. And access to that trail is really key. And I think that we can be really helpful with folks who are trying to restore some of those plants, because there will be opportunities for volunteer and community helping to. I think that's really vital.
Will excuse me? If a person is not finished in 45 days, can they be kept for longer than 45 days in the?
The trail, they put this all, okay, so trail that was like for people in wheelchairs and whatever, okay. So that won't be something that others can use anymore, or?
Dean, I'm with the Vashon Land Trust. We own the property where the trail is. Dean. I'm with the Vashon Land Trust. We own the property to the public. It always has been open to the public. It will be through VCC. That access was for residents and their guests. There's a separate trailhead for the public on 156. So both the residents and the staff and all of Vashon and all of the public will still have access to the trail, but through separate entrances, if that makes sense without a map.
All right, just clarification, but my other question was, I don't know if this is on. Okay, I don't feel like I got a sense for what happens to the 40% who leave treatment early. We don't.
We would
Steve Norris.
Can you hear me?
Yes.
Okay. Um, I'm sure everybody has lots of questions and I do too, but how best can we help? I'm retired. Time is something I've got, well, it's limited, but I have a background, I have a master's degree in social work and doctorate in disabilities and special education. And I did volunteer out at the Women's Correctional Center for about 20 years, working with women about 6 months prior to their parole and did counseling. How can I help you?
Well, hi, Dr. Love. I get super excited when I hear that because we are definitely looking for more people with expertise and especially people here on the island. And so I think that, we've been dabbling a lot more with getting more specialty care. So right now we're looking at adding even a psychiatrist to our team. But one of the biggest things that we need is master's level social work. So I'm really excited to hear that you have that. My biggest hope and dream for especially the women who are pregnant or pregnant and parenting people is that we keep those babies with their parents, which is not something that I think a lot of pregnant people get a lot of support around in addiction. And so I think your experience and anybody else who this experience, especially working with people who've dealt with substance use, is really, really important to us. So I would say definitely email us if you're interested or know people.
Can you send me an
interested
email?
in working with us.
Can you send me an email?
I'd love to get your email.
Okay, and that also reminds me, one of the programs we worked with there at Purdy was women that had been convicted for had less than 2 years to serve and were pregnant, and it was really important to get them back with their children and bonding, and that was really an important factor in their reducing their recidivism, was bonding with the kids. So I worked with that program real closely too. So I'd like to sit down and talk with some of you sometime.
Yes.
I think
I would love that too. And I just wanted
Eileen has my email. So
Who?
Eileen.
Okay, I'll get your email. Okay.
Okay.
Great, thank you. The other thing that I just wanted to mention too is that we will have childcare on site, right? And so we're looking at, for those 10 folks, some of them may already have children. They may also be pregnant, but we are looking to be able to offer people up to 2 children up to the age of 5. And so we're also looking for really good childcare on site as well. So those aunties, those grandmas, those people who can really wrap their love around these children is going to be really, really important.
I'm Mark Thorne. I will live right next to you as well, and I'm very concerned about what I think is going to be the potential for a huge uptick in crime. And I, Beverly asked you about that, and you didn't address it. So I would like to know, what are you going to do with the 40% of the people that walk out of there? And I hear what you said. You said we help them, all of them, because it just takes one to be a big problem.
Yes, all of them. Every single one. Okay, so this is the conversation we can have. If you're asking me a question, I'm going to answer your question, but if you're not going to believe me, then we're probably not going to move forward. I think I did answer the question that yes, we have a team of providers that's dedicated to helping people move in whatever stage of recovery they are. If they want to leave, we help them leave. And we never had an incident of crime operating a residential treatment program at 65 beds right in the neighborhood. Those are the 2 answers I get. And so you can look into those answers if you'd like. And you can look into those answers if you'd like. And you can decide whether or not you want to move with us, right? That's all I can offer you. So you'll just have to see.
Hi, I'm Sindra, and I'm a neophyte on the island. I've only been here 5 years. So I just want to hopefully clarify what seems to be a glitch here. I worked at Harborview as a mental health specialist on their units that was my career. And we had patients go AMA that would sign themselves out and say they wanted nothing to do with it, those that weren't involuntarily committed. And at Harborview, you signed out AMA, you got your belongings, and then you were let out the door and go down and they were free. I don't know how else to phrase that right now. And so I think that what I'm hearing is that type of concern from islanders that if somebody in the program says, you know what, this is just not where I am right now, I'm out of here. The islanders are saying, what happens to them? Do they just, or what you're saying is that, no, okay, they say, I'm not in this space right now. You're saying, you folks say, okay, we will assist you to take you back to your community, even though it's AMA or whatever terminology is used now. Is that correct? Yeah, so, okay.
We're running down to the last part of this segment here, so maybe one response could be how any unanswered questions tonight they can contact.
Sorry, I'm just going to quickly summarize. One of the themes that's emerging among the online commenters is, this came as a surprise to a lot of folks, and they weren't aware of it before it was finalized. And is there a reason why? And is there a commitment to being open with the community going forward?
Yeah. So when we were looking into the facility, we were placed in a non-disclosure agreement. So we couldn't talk about it then. And so once we were released from the non-disclosure agreement, then we did obviously the Beachcomber article, which was great. And this is the Strawberry Festival, honestly, was our first launch into our community engagement strategy. It wasn't about intentionally keeping information. It was just, we make sure the property was going to work for us. We had to make sure, just like if you're buying a home, you're going to take a look at it and you're going to where's the money that you're spending on it. And I want to just be clear about that. We did buy the property outright. We bought it cash. And so, I'll ask you the same thing. Like if you bought your cash, are you going to give all of your plans and designs to your neighbors? We bought our home.
I think we can take a couple more questions before we wrap up.
Hi, my name's Mike. I've been on the island 63 years, 125. What's that? Land, yeah, 125 years family's been. I have a permitting question. 92 beds was 65 before. Actually, I know all about the nursing home and rarely got to 65. It's usually closer to 30. So this is a dramatic increase. And to the neighbors' comments, this is a huge volume increase, whether it all goes great or not. And there's a lot of traffic and there's noise concerns and security concerns. So what is your permitting process? What stage are you at? Who are you working with? That's my question.
So all of the permits were analyzed during our due diligence period. So we had 120 days to fully analyze what the permitting requirements would be. And they looked at all of the engineering and the sewage. The mic may not help you, but I will project more. So we had a due diligence period of 120 days for the property. And in that 120 days, we did analyze all the permitting and with the expectation that we would get to 92 beds. The VCC wasn't 65, it was 56, it had 56 units. And so when we wanted to go to 92, obviously there was a lot of focus on the engineering pieces of that, right? Mostly to the sewage. And all of those came back in our favor, that we wouldn't have to make any modifications to get to 92 beds. And so the permitting process right now is with the Department of Health. But all the other components of that, of getting the facility prepared for 92 beds, have passed. Yeah, so the 92 people are not going to be, in most cases, driving there. We'll be picking them up and taking them there. Now, when you talk about like what types of residents we're going to be having there, it's going to be a mix, right? We're going to have people who are paying cash, similar to the way we did. There's going to be people who are on commercial insurance, and there's going to be people who are on Medicaid. And it's our job to, to balance that payer mix so that it's not overwhelming to the community. It's not overwhelming to us financially. And the noise, I'm not sure if you mean, are you talking about additional traffic? And so we have shuttle vans that go back and forth between our clinic and our clinics in Seattle and the Vashon property. And we've, as Esther alluded to, we've done this, worked in clinics for over 50 years, right? 52 years, and residential treatment programs for over 30 years. We really know what we're doing. And the words and the answers that we're giving you are based in data. And not just our gut feeling on this. Does that answer your question? Well, if you'd like to connect with, like, all the permits are there.
I think we are about out of time on this. There's
We are at time, we're actually over time. It's 8:17.
quick question.
I may have missed you. You saying when I'm asking the question. I was under the understanding that people from this island who need assistance with drug and alcohol would be able to be. And what would the process be, and how would they go, or whatever? Could you talk to that just quickly? Thank you.
Yeah, so we function in county. So for non-native folks who want to seek treatment, they would have to be referred right through the county system. So it's the same as any. We're part of that referral system. And yes, we're open to everyone. So that's how that will happen. For native folks, we're part of the Indian Health Service system. So we have different access points where we get referrals directly from tribes and other urban programs. No, they have same as all of us, right? In our room, like, folks who have insurance, some folks are on Medicaid, some folks will have enough resources to pay cash. So we'll have a mix of that. Sure. So we would help them get enrolled in that. And that typically happens in the referral and intake process. Yeah.
I know we didn't get everybody's question, both online and here in the room. I really appreciate everybody coming out. We very much appreciate all the folks from Seattle Indian Health Board coming out and walking through. I hope this is just the first of many conversations that we'll continue to have. We will post the presentation. I'm sorry we weren't able to get our technology together. We will put it on our website so folks can go look at it later on the website. And we will capture any outstanding questions from the chat, or if folks have other questions they want to send us, we will do our best to continue to collect information from folks at Seattle Indian Health Board and answer those either at our next meeting or on the website. And we would welcome you joining us as things progress over the coming months. We would love you to come back and join us again.
The only thing is there are 2 YouTube links built into the presentation that gives you a history and background on the Seattle Indian Health Board and help you learn a little bit more about physical media.
Thank you. All right. Thanks very much. Okay, we are going to shift gears. I know that was a lot, but we have other things going on. Thanks.
Do Terry's shoulder.
Okay, we'll just let's take a minute to regroup here, folks.
Thank you very much. Appreciate it. Yeah.
Okay.
Yeah. Could work out very well, but
All right.
neighbors'
Give us a minute.
concerns are legit too.
Sure. This woman, Katie, I don't know who she is.
Thank you.
Sounds angry.
Yeah, she sounds like she's had bad experience with homeless drug addicts and
Pretty chatty. We do have a meeting we need to continue
here.
on. So if you'd like to stay for the meeting, please stay for the meeting, but if you would like to stay for the door, thank you so much.
Yeah, please stay for the meeting.
Okay, we have a few more things to go over tonight. Thanks those of you who are hanging in there with us. Not the least of which is the Strawberry Festival update. John, you're up. We've got committee updates. And hopefully many people were out at the festival.
Yeah, we completed our festival. This is the second one we had. It's as an organization. A breakdown of the resources. We sold 212 shortcakes. Our shortcake net was $843.
Oh, yeah, we should tell
Thanks, John.
Yep.
So the next item we're moving on to is Strawberry Festival Committee. Thank you, John.
Yep.
tell us how we did.
Yeah, thank you.
Wow.
We sold 212 shortcakes. We netted $843 in shortcakes and we got $13 in donation.
$13.
So in a total, the total amount of money we collected for Strawberry Festival was $856. We also have an additional $1,000 coming in as soon as I turn the receipts into the county to get our grant money. So it was successful, not as successful as last year, but we've got a lot of infrastructure that we created. We've got a booth now and chairs and tables and a process that we can improve on and 12 months to figure out how to do better. And that's the report.
Thank you. And John, thank you for all you did organizing that. That was great. David, if he's still with us, hopefully, I don't know if he has an update on the town plan committee. Oh, David is there.
Okay, here I am. Can you hear me?
Hello, David.
Hi.
Yes.
Yeah, the town plan committee had 2 organized meetings. It was well attended. They're also recorded if anyone wanted to get recordings of the Zoom meetings. And the task essentially was we were given until July 15th. That was supposed to be the end date for our comments. And we were tasked with reviewing all the P suffix condition changes and the special district overlay changes as they applied to the town of Vashon. Now, it looks very scary when you see all these changes, and there's been a lot of suspicion that the county is trying to change our island and make it into a busier place, you know, more housing, et cetera, et cetera. A review of the changes, the proposed changes, does not indicate that they will have really much effect on the island. There are two changes that, you know, we also looked at. One was that they are planning to keep the Burton Inn property as a hotel kind of facility, as opposed to opening up to neighborhood business. But the owner of that property will be addressing that issue with the county directly. Also, the area where Granny's Attic was has been looked at, and the people who own that property will be dealing with the county directly. Other than that, we did not see any significant changes that were being proposed that would affect the town of Vashon to the degree that we would need to really voice our opposition to anything that's being proposed. It was a fairly benign process that was, I would guess you could almost call it bookkeeping, changing names, changing things that were no longer needed. And so the town plan committee saw no reason to vote and voice a specific opinion to the community council to be ratified and brought into the process. The comment period for the comprehensive plan updates for 2024 has been extended until Monday, July 31st. So the July 15th deadline was extended for 16 days to give Vashon Island more time to make individual comments, and anyone that wants to is free to do so. What I would recommend, though, is that before people make comments to the changes that the county is proposing, that they read the changes that the county is proposing. And that's not always done. I think we've seen a lot of comments that show great opposition to things that are not being proposed. So if you do want to make comments, I think it's great, but please read what the changes are before commenting. We may have more things to do as the comprehensive plan goes on. I know there are a lot of people that would like to see sidewalks improved. That's a really important issue. There are other issues that, you know, the town has that are not being addressed through this comprehensive plan update, but that doesn't, we're not precluded from trying to change these things in the future. Okay, so that's my report.
Thanks, David. Katie, you have a question or a comment for David?
Hey, David. First of all, I appreciate all you've done. I mean, I really do. I know this is like a, you know, a thankless job and all of that. Sincerely, I mean that.
Okay.
I do think though, because I lived in a place that was a lot like Vashon, you know, it was like going back in time, and, you know, it like people had, you know, it was basically a time warp, old buildings and charm, and the community was so tight. And that's what Vashon is. But what happened to that other place is that when developing change, when zoning changed, developers swooped in, and the charm of it left, the community left. And, you know, I know that on the last call or on the county Zoom, that the lady, I'm forgetting her name, said, oh, I've talked to developers and they don't seem all that interested in coming here. The problem is they might not be interested today or tomorrow. The problem is they might be interested in a few years or a few years after that. So when the zoning changes, and then people hang on, when the people on the main street in downtown Vashon are selling their properties, they can knock down these old buildings. They can knock down these old buildings. They can put up 2-story buildings. They can, you know, this is happening a lot in a lot of areas around the country where they're putting storefronts on the bottom and condos on the top. And so the danger in having this zoning change to a way where there's a fee in lieu, where developers don't have to make it low income housing, they could really destroy the feel, the look, the vibe of this island and why we are all here.
Okay, now Katie, I agree with you about the fee in lieu provision, and the town plan committee was very much in support of the community council, which took the position opposed to the fee in lieu and has very clearly stated to the county that the community council is opposed to having a fee in lieu, where instead of affordable housing units being built, you would have market rate housing being built. That is the only real change that we thought that needed to be opposed. But you see, the committee only can speak through the community council. And the community council has already made that very clear that that's their position. So we agree with them. Other than the fee in lieu provision, there are really no zoning changes that are being proposed that would invite development. So if there were, I think we would take a stronger position, and we would take a position on fee in lieu, but we didn't have to because the community council has already taken a strong position and has communicated that to the county.
Okay, I'm still,
But
I'm not,
individuals
not,
still can.
sorry.
And
I was gonna point-
individuals
can
still have
shift.
16
Absolutely.
days, yeah, to express their opinion to the county. And
Okay.
I urge you to do so. But
Okay.
before you do so, and yeah, if you would join us and say that the fee in lieu is a bad idea, go for it. Really, I think that's a good idea.
I do think that's a bad idea. I'm sorry, you guys failed to unmute me, so I'm going to keep talking. The fee in lieu is a bad idea. I also think it's a bad idea to overdevelop downtown. I really do.
But
And
there's no
if you-
call for that.
Okay,
No one
but
is
that's how
asking
it
to
appe-
overdevelop
That's
it.
certainly how it appears when you look at your map and you know that you can build 35-foot buildings, 2-story buildings, and that is what I believe will happen. I think downtown is going to be, it's going to be too dense. The charm is going to go away, and it's going to be taxing the water, the septic, and all of that stuff.
Katie, that
for
was
me-
available since 1996
Yeah,
when
I'm
the
an-
town plan was implemented. That same 35 feet was in the town plan when I was chair of the town plan committee back in 94 to 96. So developers have had the opportunity to take advantage of that in the past 30-something years, but haven't. And one of the reasons is there's not sufficient water to do so. Now, Water District 19 opened up 14 available water shares, but that's 14 shares. That's not 200 shares. So this has been in the town plan for 30 years. It's not being changed.
Okay, my other thought to this is there could be an overlay on Vashon to allow ADUs, quick permitted ADUs, some pre-planned architectural drawings that the engineering is done. This could help people, and it would have to be it could not be an Airbnb. It would have to be a contract with the county that they're going to provide low-income housing. This could also help people in low-income loans for people to build. It could also help people who are having a hard time with the taxes going up.
Oh,
So
I agree.
to me,
ADUs,
there's another option.
ADUs are a good option, but it's not something that the 2024 comprehensive plan was addressing vis-a-vis Vashon town. And I think there is the other issue, should we allow Airbnbs in the town of Vashon, which has the kind of services that would be helpful for affordable housing, and by allowing it for Airbnbs, you might be precluding using this for affordable housing. Those are valid issues. Those are good issues, but this is not exactly the time that we could address those issues.
I'm just
But
saying
that doesn't mean
there's alternatives.
we can't do that in the future. And I urge people, you know, that's a good idea about trying to increase Airbnbs in the town. Again, water and sewer are usually the restraining factors.
I understand.
Thanks. David, I'm going to need to move us. I'm going to
Okay.
need to move us on. Sorry that we were just going to, it was supposed to be a quick update, but those were good discussion points, and agree, David, great job on this committee. Thank you. Morgan and Jim, I think, are not here for post office and affordable housing committees. Justin, do you have an update for us on the ferry advisory committee? Is Justin still here? Oh, no. Okay. Jake, transportation.
Jake Jacobovich, Transportation Committee for the Vashon-Maury Community Council. So I had a meeting with John Taylor, the director of the Local Services Division, and in my effort to launch the Transportation Committee for the Community Council at their request, that we didn't feel like they were being attacked especially our local roads people feel like they're being attacked. They're not. I'm just saying, I don't want that to appear that way. And so I'm moving cautiously, because the Transportation Committee not only deals with the roads, but it deals with traffic engineering, it deals with metro bus service, it deals with the water taxi, it deals with Washington State DOT grants, a whole ballpark of things. But I'm a short timer, I've only been here 47 years, but knowing how the mind works here on Vashon, I didn't want them feeling attacked and preyed upon. So I'm setting up a meeting. He's told his roads director to meet with me and the community council board, perhaps, just to go over what this is all about. And it's just to have the community having a voice in all those different modes of transportation. King County always lays out there that mobility is a human right, and that puts it up pretty high on the scale there. So and it relates to things like sidewalks, like David was talking about. And you know, I've gotten a lot of grants from a lot of different places, King County, WashDOT, this and that, for transportation projects around town that you don't even know about. But anyway, so that's what's going on there. I was only able to get so far one member, but a pretty powerful one, our fire chief, Fire Chief Vinci. He's volunteered to be on the committee. I'm going to ask the chamber, which may be Amy Dreyer, the executive director, for her to be on the committee, and then maybe find 4 community members and have a good sort of nucleus there to move forward and see where things go from there. But like to get this started and have a meeting in September, so I'm working hard. I'm even offering free beef to join the committee. So, okay. And there is a mission statement. I don't know if it's on the community council website or not, but Diane has it, and you can see what it's all about.
Thank you, Jake. And I know John is actually on so thank you, John, for being willing to talk with Jake about that and having representation. I don't know if you have anything you want to add, John Taylor.
No, hi, everybody. I just joined in. I wanted to hear the Indian health discussion since I'm coming next month, and
okay,
just appreciate all of David's hard work on the land use committee. Nice work, David. It takes a lawyer to really dig into land use. No one else wants to do it.
Yes.
Diane still has it.
Yes, John, someone is asking if you have the asphalt. And we said that
I'm getting the asphalt next month. I'm coming in August in person. I got a bunch of paper that blew away just now as you were talking, and I need it badly as a paperweight.
excellent. We will see you next month in person. Look forward to that.
Awesome.
Great. We have some board updates. We have some sad news. I'm going to turn it over to Kim, who is going to be leaving our happy group.
I am resigning from the board. I'm still going to be very active in the community. I think I can be better used in different ways, my time as well. So I did during our board meeting this month, go ahead and formally resign, but I wanted to make sure the community knew that as well. But I am not going anywhere in the community. I'm still very much here. Just very, very busy. So.
Kim, thank you. You have been a great member of the board. We are going to miss you very much. Totally understand you need to prioritize your time. But this is a great reminder that we are welcoming other members to the board. It's a great group. We have a lot of fun. I think, you know, as folks have been probably following over the last year or two, that this is a new reconstituted council. We've been going at this now for a few years with a number of folks sort of pulling this back together. I think it is still a work in progress, but there's huge opportunity. And I think those of us who have been spending some time on this really believe in the idea of giving our community an opportunity to have voice and come together and wrestle with things and make things better. There's been lots of things that have happened because of the efforts of this community council over its various iterations over the years. And I think there's huge promise here. There's lots of things happening in our community and lots of possibilities. So we would really invite anyone who's interested in working with us to join. You don't have to have any particular experience or background. It's just a willingness to participate and help be a voice to the community. We'd particularly love to hear voices that we haven't heard as much historically. So really looking for people to join. So you can call any of us, email any of us, or on our website, look for the contact information, and any of us would be happy to sit down with you and have coffee and talk more about it. But give it some thought, and we would love to have you join. Yeah, not in the grocery store. Let's see, new business. I know one item, there may be others. There is a plan for us to help host a candidates night on September 21st. We have an election coming up this fall. And the idea is to invite as many of the candidates that are eligible in our voting area, King County, and our voting area here on Vashon, to come join either in person or by Zoom. We'll probably be meeting at the Presbyterian Church that night so that it's a neutral place. But looking forward to that, and hopefully folks can join in and hear from many of the candidates and help think through how you're going to vote on important issues. Any other new business that folks want to mention? Or community updates? We can move right into that. Any other updates, news from anybody? Yes, Ben.
I just wanted to follow up on the Strawberry Festival issues. Awesome that we sold that many. My daughter and I, she's 11, we did an informal taste test between our strawberry shortcake and the Rotary's strawberry shortcake. I'm going to go for it. And so we had a better price point, but they also offered an upsell with the ice cream. And the ice cream took it over the top. I'm going to be honest. Was that right? Okay. I just wanted to put it out there, speak it into existence, and speak it publicly, that I think next year ice cream will be a great addition to our community council booth. Oh, and Jake wants me to. A better location, Jake says. Yeah, I mean, obviously the counterpoint is it does cost more money to be on the main drag, but do you make that much more money back if you're on the main track? So I think it was $300 or so to be on the main track. I definitely felt a sense of competitiveness with the Rotary for next year. So
yes.
So for community updates, we received an email just to let everyone know, if you aren't already aware, Solaria Farm moved over to the Villages. They're no longer in front of Ruby Brink. So they had reached out to us just to make sure everyone is aware. They are doing very well over there, and safer for walking and parking and all of that great stuff. And also are doing a great job to hire youth within the community so that we're starting to build workforce within our community, which is great as well. So just a community update there.
Any other updates, announcements from other folks in the room? Anybody online? News? Gossip, good jokes? Oh no. Olive oil cake with strawberries. Oh my gosh. Raising the bar. Okay, any other discussion? Anybody on anything on somebody's mind? Yes.
I was out, so I just came in. Have you discussed the proposal from King County regarding Vashon and the changes?
Yes.
You've already just.
We covered that. She was asking about the town plan. I'd suggest you reach out to David Vogel directly. Yep. Okay. Any?
I know I should have said something earlier when you were dealing with, when David was talking, but is this council giving King County's zoning folks the community's response to that? I mean, is the council taking a stand? I guess that's what I'm trying.
Oh, sorry, I lost you just before. The council is not taking a stand based on what the town plan committee has done, because it was our opinion that none of the changes other than the fee in lieu were significant enough to take a position on. And so we will have more meetings if we think that we can help with the process, but we are not taking a position and we are not asking the council to take a position different from the one that they've already taken opposing the fee in lieu.
Yeah, I think the main point that David had was the main point that was identified by the committee was the fee in lieu issue. And that part, the council, I think unanimously said, we agree, it's not a good idea. But there was not anything else that they identified of concern that needed us to comment on at this point as a council. Individuals are welcome to do that on their own, and you've got until the 31st of the month to submit that to King County.
Absolutely.
Okay. Katie said, yes, she does. She thinks we should have Seattle Indian Health Board come back to answer questions. We would love them to come back. So we'll reach out and see if that's something that they're able to do. Because yeah, we probably could have spent 3 hours with them tonight. I know there was a lot of discussion. So I think that's a great idea, and we'll see if that's something we can make happen. Okay. Next meeting is August 17th. We will be right here in the Land Trust building or on Zoom. Hope you all can join us. It was great to have so many people here tonight. All right. We will stand adjourned. Thanks a lot.